My name is Dr. Mitch Ogles from Cape Girardeau Urology Associates, and I'm here today to discuss with you sacral neuromodulation. Sacral neuromodulation is using a tiny electrical stimulator to stimulate the nerve that carries information from the bladder back to the brain. By changing the way this nerve fires or sends signals, we're able to adjust the way that your bladder functions to try to improve your bladder function. Some people consider this device a pacemaker for your bladder because it changes the way that this muscle, the bladder, functions. Other people like to consider this rehabilitation for your pelvic floor muscles. The pelvic floor muscles are very involved in how your bladder functions, and by changing the way those muscles function, we can improve the function of your bladder. There are several patients that are appropriate for using sacral neuromodulation. The most common patient is somebody who has tried and failed behavioral modifications for bladder control and has tried and failed medications for bladder control. Some patients aren't able to take the medication or it doesn't work well enough, and they choose to move on to a more advanced therapy like sacral neuromodulation. Additionally, we use this device to help patients that have fecal incontinence that has not responded to other treatments, or urinary retention, the inability to urinate that has not responded to other treatments. One of the nice things about sacral neuromodulation is that patients are allowed to test the procedure before committing to it. The test is done with you awake with some small numbing shots made over the tailbone. Your doctor will then insert a small wire alongside the nerve carrying information from your bladder back to the brain. As a physician, I can tell this wire is in the right place because the patient will feel stimulation, vibration, or a slight tugging sensation in the area between their anus and their genitalia. Some people refer to this as the bicycle seat. Once the wire is in the right place, which takes less than 15 minutes, it is connected to a small battery that you wear on your hip for 5 to 7 days. During this trial, you will record how often you urinate and how your symptoms are doing. We expect you to improve at least 50% in order to be considered for implantation of the permanent device. If the simple test fails, or if your doctor decides that a more advanced test is needed for other reasons, you may be offered an advanced test. During the advanced test, you're put under a light anesthesia and a larger, more permanent wire is placed next to this same nerve. This is then connected to the test device. If you improve with either of these tests, you would be a candidate for sacral neuromodulation implantation. This generally takes 30 to 60 minutes, and during this surgical procedure, a matchbook-sized battery is placed near your pocket of your pants underneath the skin. This stimulates the nerve appropriately. Once you wake up, you'll be provided with a cell phone-sized controller to control your new device. The battery that we use generally lasts for 10 to 12 years, and the controller is something that you bring with you to your appointment so that we can make changes to your therapy as needed.